Let's workflow tonight.
One. Good afternoon, dental internet world. My name is Dr. Vishal Sharma, once again here alongside my friend and colleague, Dr. Mike Parchewski. Mike, you just had laser eye surgery, and I'm curious, as you look at me in a multidimensional aspect, do I look more aged after that eye surgery, or am I looking more youthful? Let's put a pause on that very awkward introduction, but that's going to be a segue into our topic today, not staring at me longingly, but I'll allow you to introduce our guest, Mike.
Well, thanks, Vish. It's good to see you, and literally good to see you. And so I'm appreciative of my improved vision, and realistically, my big thing for me, I was just getting tired of wearing contact lenses in Calgary. The dry weather just wasn't conducive to that, and I'm feeling much better for that. So I appreciate you mentioning that. And I'll be honest with you, and this takes us into our digital patient talk today, but nobody really looked differently to me, but when I looked in the mirror, I was like, dude, you need to clean up a little bit. So it was more self-reflective than anything else.
I always make sure if I'm looking in the mirror that contacts are out or glasses are off.
Yeah.
And I like what I see looking back at me with the squint version.
Exactly.
Are you still comfortable with your decision seeing me in person again?
No, I think we're good. And on that note, welcome to our special guest today from Aurum Ceramic. We have Robert Hawkins, who's the VP of Business Development at Aurum Ceramic. And what Robert's been working on is a very cool project called the Face 4D Studio. And that is allowing essentially dentists to digitize their patient. And in the world of AI, I think it's a great timing for this. And the ability for us to do face scanning and things like that is fantastic. But I also feel like, and I know we'll dovetail into this, but the cost of things have gone up, and many clinicians are not looking at major purchases in this year, as from what, from talking to other dentists. People just are unsure of what's going to happen in the market. And so, Robert, I think the Face 4D and what you guys are doing to share resources is very important. So why don't you give the listeners an overview of what the Face 4D program is and what it is all about?
Yeah, absolutely. Well, first of all, thanks for having me. Really appreciate it, and an honor to be here. Face 4D really started as we identified as a lab a gap in the diagnostic step between treating a patient. So we have all these different tools and technologies, and like you said right off the top, they're not cheap, right? And so for here serving Calgary at the Face 4D Diagnostic Center, we said, let's invest in all of the equipment and make it a seamless experience that integrates all of those digital tools. So you can refer your patient to us in the center, and we can say, okay, come on in, get a face scan through CBCT, intraoral scan, and then we can do some jaw motion tracking as well too. Then I have a full digital patient to work with. No one in the world, occludes like that, like the cheap little plastic dentures, right? Not even the single pin articulars. Nobody's chewing like that. So why are we still in 2026 practicing dentistry and communicating in our restorative workflows with those tools, right? So that was kind of what stemmed the diagnostic center here in Calgary, was the need to kind of bring all of that together in one seamless workflow for sure.
Well, it's interesting innovation, and certainly we commend you for being a pioneer in the field. Like obviously for Mike and I, we're big proponents of digital workflows. I'm the VP of Education at Spear. We actually just hosted the product that you're talking about with the jaw tracking. We just had Dr. Wasim Salmi do a mod jaw workshop this past weekend. So, our prosthodontists and our faculty, they're believers in that. Mike and I certainly understand the benefit of all of that technology. And it's just incredible that Aurum, an educational institute, a laboratory, has now developed that studio. But it's almost more like a complete operatory. And although I haven't had the opportunity to visit it, I've seen images of it and it looks incredible. Discuss with our listeners how a local clinician or someone maybe even further away would be able to utilize the center and what support there is for them to complete these complex cases that Aurum's known to be able to very effectively support dentists on.
Yeah, so obviously the easy answer is if you're here in the Calgary area, you can refer a patient to us. It's as simple as that, regardless of, for some reason you don't have an intraoral scanner, but you want to try the digital aspect and you don't want to invest, you can come with your patient we'd love that, absolutely. But you can also refer a patient to us. We'll bill directly back to you or direct through insurance or fee for service if they don't have coverage. And depending on what patient needs in the treatment plan, absolutely, we can help them out. You mentioned very astutely, we do have 2 operatories, one typically for more basic procedures, imaging services, and then we have a full teaching operatory as well too. So how we support people outside of the Calgary market is through education, live webinars, things like that. We have cameras, audio streamed in there, and I know we haven't had a chance to come and see it yet, but definitely full surgery. I mean, people who we've brought through, Dr. Khanna, Dr. Desi, people like that, they're like, yeah, I would totally throw in implants in here, things like that. They're like, I just wouldn't do a sinus lift purely for the cleanup. Really, that's the only reason why. It's fully operational with cameras, and so anything complex, full CBCT imaging, custom shade taking, intraoral scanning, all of those services are available. And the nice part is it's literally downstairs from the rest of our technicians. So if you're restoring with us, the communication is seamless between the imaging center, the laboratory, and the clinician.
And what do you do when, let's say, for example, let's just walk through a patient. So I've got a patient that needs, let's say, full mouth rehab, worn down teeth. We need to find out, the vertical position, check that. So we want to get, CBCT, facial scan, images. So who do you have there? Like if I just sent the patient over, what's the process? I would just write a prescription saying, do this. And then who do you have on site to take all these records? Yeah,
absolutely. So we've got the prescription forms and the referral forms online. So we send those to you ahead of time. And then on site, we have 2 wonderful ladies, Kim Consul, she's a registered hygienist, and Joanna Pachuta, she's a registered assistant. So they can go through, take all of the imaging that you need and all the inputs that you need, and then we parcel it back up in a compliant document, send it back to you. If you have CBCT, we do offer interpretation services as well too. Obviously, we can just give you the file back. You can interpret it however you want outside of our services. The turnaround time typically is a little quicker. The reason we invested in the CBCT, I know you've got one here at the practice as well too, is we found that here in Calgary, especially for some of the other competitors who do a fantastic job, like Canary, things like that, the wait times can be a little lengthy, even just to get in to do that CBCT. For us, we can see you tomorrow, and then we have 24, 72-hour turnaround time as well too. So there's no waiting. So for patients like you and I were discussing before we came in today, who've got crazy abscess, who need all of that imaging and potentially that interpretation, those patients maybe can't wait that long, right? So we can offer rush services and get that back to you right away. So I think that was the need that we identified in the gap in the marketplace for sure.
What's the time that it takes to do the full diagnostic workup for the team that you have on site?
The imaging or the workup for restorative?
The restorative workup.
Restorative workup depends on all what we're doing, but in the lab, once we've got all the imaging and the direction and prescription for you for what the treatment plan would be, we can turn that around in 2 days, 3 days. Just kind of depends on, again, we talked about that communication between us and you. If you've given me all the inputs that you need to restore, treat on the original RX or text message or email or phone call, whatever it may be, I can go. I don't need to wait for you anymore, right? So that's really the biggest barrier, especially leveraging AI tools to help us with design.
Isn't it interesting, and I, again, Vishal knows that I tend to promote our podcast heavily, shamelessly even. But since our podcast was launched and CBCT is a massive focus, we've noticed that the use of CBCT has just erupted, right?
Absolutely.
And if I walked us back through the history, there was a time where you would refer a patient out to get to a radiologist.
Yep.
And then as dentists started being able to have CBCTs and doing CBCTs in office, then you had some of those businesses go out of business. And then what's happened now is they've dovetailed into the digital world. So patients don't have to go in, you can just send the CBCT. And then you have all of a sudden now businesses that opened up on the digital front, Canary, Beam Readers, all that are offering services across Canada and the world. And now all of a sudden, like at that point, it was a week. You could get a week, 2-day turnaround. And this is all early post-COVID. And now they are backlogged. Yep. They are backlogged heavy. And it shows me that one, many people are realizing the benefits of CBCT, and two, people have been watching our podcast.
I was wondering how you're going to wrap that up and take personal credit for a shift in the dental technology that was invariably going to occur. So good job circling that back, Mike. Yeah.
Yeah, and for us, CBCT, whatever year, and I even heard it with my own dad. He's like, CBCT, radiation poisoning and all that kind of stuff. And the radiation levels have come down. The accuracy has gone way up. I was talking to our Plan Mecca rep not so long ago saying, you can take extraoral bite wings, which are 25% more accurate. At least that's what they're saying. It's faster. It's immediate. So yeah, the need is, I would say, and also patients are demanding that. They're demanding the accuracy and not going out. But again, if you're a clinic who can't afford that investment for CBCT, which is probably $150,000 these days, we're there. You don't have to invest in all that capital equipment. You can pay the one-off and work and integrate right into our work.
Yeah, patient needs an implant. You just send them single implant. They get the workup, and then you'd return them with the plan. They approve the plan. They get their guide. Yeah. So it's a nice workflow. Now, one of the things that's hot in the industry right now is facial scanning, facial photography, facial scanning, digital planning, digital aesthetics. And, Vishal teaches an anterior aesthetic course at Spears that really delves into, being able to do an entire cosmetic case virtually and giving that control to the dentist or to the lab to be able to do that without a lot of complex wax ups and models and quick turnaround. At your Face 4D, what are you guys using for a facial scanner, and how are you incorporating that into that digital patient workflow?
Absolutely. So at Face 4D here in Calgary, we have Maja. Maja is the one. I've been on several calls with Dr. Wasim, fantastic guy. He'll even do it at 2 a.m. his time to accommodate me, which is great. Maja is definitely the key. It's the catalyst to all of them. There's now a number of competitors out in the market as well too. Shining 3D is coming out with one as well too. So, at a, say, substantially lower price point than Maja. But right now, Maja definitely has the best package of all of it. So when the patient comes into the diagnostic center, you get the full 3D face scan from our CBCT, and then we take photos as well too to match on top of that. And then we'll do the intraoral scan. Then we take all of those documents, the x-rays, the 3D image of the face, the intraoral scan, load it into Maja. From there, then we'll take all of the dynamic motion that the patient is speaking, talking, chewing with, and then I've got a fully digital patient. The worst call I have to make in the analog days of the lab was, I broke the model. Can you bring the patient back in? That's the worst, or I broke the teeth off. And then who knows how accurate that's going to be when I glue it back on, right? Now I've got a full digital wax up, full digital patient. Right? That, to me, that is so incredibly powerful. And then, the next layer is animating AI. So the Maja inputs that we capture is still limited, right? So there's solutions out there. I won't name names, but you can take 1, 2, 3 pictures and it creates a 30-second lifestyle video of them immediately from 3 pictures. And it's pretty accurate. It's scary accurate, actually. But it's powerful for that treatment acceptance from the patient.
So somebody could even start like their Tinder account with that new, because they haven't paid for their smile yet, but they want to get a return on investment, so they could start up their account to use the AI with the new digital wax up. There's some power here.
They call that veneer phishing. Yeah. So that's different than catfishing. It's just a variation of that. So, some of that, the AI software that you've alluded to is incredible. Mm-hmm. Like you take a photo, just even a smile photo, not even a retracted one in the office, but just one from arm's distance away with your iPhone. You can upload it and you'll get an immediate 2-dimensional rendering. But the 3-dimensional renderings where you start seeing the person moving their teeth, like that is, from a case acceptance perspective, very, very impactful, no doubt.
Remember that, was it Smile Effects, way back in the 2001 was the first digital smile software, that they were doing from the Extreme Makeover and stuff.
Yeah.
And, it would look very 2-dimensional, and like there's a person and with these white teeth. And a lot of times people would go, ooh, that's going to be me. And I agree with you. That 3-dimensionality is unbelievable because it's like the lips are in motion and it's a real rendering of what it could look like. So big difference. Yeah.
Huge difference. Yeah. I mean, even predate that was they used to have I think it was LVI or Spear or Coyce. They had even literally the paper that you would just print out, put it on the patient's teeth, and it was like, the perfect way. It didn't match their facial dynamics or anything like that. But look at my perfect teeth. And I don't know what the success rate of that was, but we've come a long way from taping pieces of paper on the patient's mouths to where we are now.
Even the smile trial aspect, where you've got an additive wax up and you take your Bisacryl and try it in. Like in the course that I teach on anterior aesthetics, we actually suggest shying away from that, because from a patient perspective, everything about that feels awkward. So they're going to associate the awkward feeling of these over temporaries that they've had no time to get accustomed to. And everything is an apology. Like you'll say, I know they feel awkward, but don't worry, you'll get used to them. Yeah. I know your speech is off, but don't worry, you'll adapt to it. I know they're monochromatic, but don't worry, the final porcelain from the lab will look great. I know, your gingiva is all covered over and it's all white as well, but don't worry, everything is just an apology. And I think for people, it's tough to differentiate what you're seeing versus what you're feeling. Your feeling will overcome it. So for them, they're like, this feels really awkward. There's no way I'm going to proceed with this. Whereas if you have a visual tool where they're looking on the screen, they can be more objective about it. So yeah, I wholeheartedly agree with that approach. And the digitization of this, the predictability is just, it's incredibly invigorating for sure.
Yeah, and I agree. The same thing with the implant planning. A digital implant plan, when we teach the, implant case acceptance, it's, we know that we can do it because we've got it all digitally planned out. We know where the nerve is. We're not going to hit the nerve. We know where the alignment is. We're not going to have it out of alignment. We're not going to hit an adjacent root or tooth. And we know that the implant size. And so it's funny when I say this to patient, hey, Jane, you know what, your implant, we can do it. You have enough bone. We won't need grafting. And, by the way, we have your implant in stock. And so we're ready to go anytime. And they go, oh, well, when? I go, well, what are you doing in an hour? And that's powerful because the usual routine is you're feeling the bone and going, we might have to graft. What's a graft? Well, we have to flap the tissue. And then they start hearing this just like that. Like, maybe we're not sure, we might have to do this. Oh, by the way, and it sounds very wishy-washy. Yeah. So I do like what you're saying because, whenever we do something in dentistry that is not accurate or is not representative of the final, that you're saying words like, I think this is going to be, don't worry, it's going to be better, and you're apologizing, I agree. It's setting the patient's expectations in the wrong direction.
Yeah. And kind of pivoting on that, like you and I were just discussing a case that's being worked up, which I can see some applications for this. Do you want to talk about that?
Sure, yeah. So for this case, we're working up is a full upper and lower arch, heavily broken down dentition. We're going to root bank, save a lot of the roots, do a lot of, buccal shield technique to save bone, and then place implants and go FP1 upper and lower. And, what we were doing, so we did the similar where we scanned, we got images, and we were able to do a digital wax up. We tried it all in from his CBCT and bite. And it was amazing that we were able to 3D print temporaries, put the temporaries over top of his existing teeth. And he literally goes, oh, I love this. This feels great. And, it was like instantaneous that, oh, my bite feels good. Everything feels great. We're good to go. And it's a very powerful. He's like, so literally $60,000 case. He's like, can I come this month? Can you fit me in? And that is the power. And I think for dentists, like we, obviously Vishal and myself, we teach and we educate and we train and we have all this technology. But for new young clinicians coming out, to be able to go to your facility and to be able to complete harder cases and learn harder cases and watching the podcast will help. But they're able to take on without buying all this equipment, but they're able to have that support, I think is a pretty powerful setup.
Yeah, absolutely. Coming in, I mean, we have Aurum Tech Digital Implant Solutions, which is beginning to end surgical planning from single pilot guide all the way up to, full bone reduction and planning the restorative all the way to the very end. So for us, it's a great way to get into the all-on-X. So even if you're placing singles and you want to get into that beautiful case like you just described, you can come to us. You don't need, all you need is an intraoral scanner, and the software validates the passivity on a full all-on-X case. So it's a really great way to get into restoring all on X as well too, because then you can layer the different scans, you can plan the final, put the temporary in, validate the scans, and then you're good to go. Really, I mean, I oversimplified that quite a bit, but your podcast listeners are very smart, so they'll figure it out.
It is interesting, though, with the advent of technology and how much support there is, that I think more dentists are able to predictably execute more complex treatment. And, technology is certainly not a substitute for skills, but I think it certainly increases the ramp to get there and the confidence. You talked about predictability with single implants. That level of predictability is not only confidence inspiring for patients, but also I think really opens up the mindset for dentists who maybe have been hesitant to take on those cases because they know exactly what the end result will be. And Robert, kind of pivoting to that, obviously for some restorative cases, for dentists, layering in the TMJ is a significant aspect and can be a concern when there's vertical corrections or potentially even some underlying TMD issues. Walk us through the digital articulator protocols that you're utilizing at Aurum, what those techniques entail.
Yeah, so definitely the ideal workflow would be to have them in a mod jaw. So if you have any kind of TMJ issues, layering in that CBCT into that mod jaw, I can see exactly where they're seated, where they're not, and so really we try to leverage a lot of that as possible. Of course, we use all the design software available to a lot of the clinicians as well too. So ExoCAD, 3Shape, things like that, co-diagnostics, depending on the practitioner. It just really depends. But ultimately, if you are changing video, you've got TMJ, TMD issues, having that mod jaw, that shining 3D, that jaw motion tracking is going to be the clearest picture for you, without a doubt. Sure.
I haven't seen the Shining product, but it's a company that's certainly making a lot of waves in the dental digital space. And one of our resident faculty members, Julie Kwan, is a big mod jaw proponent and actually has incorporated into it in our occlusion workshop. Mm-hmm. So not only from a perspective of restorative dentistry, but even diagnostics, it's really effective. So yeah, it seems like such a great evolution, great tool.
Yeah, you've used the mod jaw. Have you?
Sparingly. Yeah. Like if you recall, a generation ago, you and I utilized the JMT from Sirona at the time. Yeah. Kind of a similar protocol. You and I flew to Bensheim to test it out. And the validity of it was certainly apparent. But I think just how onerous and inconvenient that system was to utilize was probably its downfall. Whereas mod jaw has taken it to the next level. So yeah, you can, when you're expanding or opening a bite, you know exactly where the TMJ position is. There's no ambiguity from that perspective. Again, it circles back to that predictability that we were just talking about. It gives a clinician a lot more confidence with proceeding forward with complex treatment.
Well, and the upside to it as well too. I mean, everyone says, well, it's only for TMJ if I'm changing the vertical. And no, like if you're just prescribing even a night guard, I mean, if you've already got it or you want to send them to us because they've got a heavy bite or there's something crazy going on, we can do the mod jaw. If all you need is a night guard or a Brux guard or whatever, we can use it for that. It's not, necessarily the front and center use case for a mod jaw or a jaw motion tracking, but that can have serious impacts, especially in, airway is everywhere, sleep is everywhere. If you're changing, using Marpies, things like that, understanding how they're breathing and making sure their bite is stable while they're going through those therapies as well too, is a great use case for those devices also.
Yeah. And I think, just to bring this full circle, the sharing resources is so important, right? Mm-hmm. And leveraging partnerships. And I have found, one of the, COVID sort of, I think, changed the way people are. And, dentistry I found was always a very dog-eat-dog kind of environment and very sheltered. You didn't want anybody to know what you're doing. And I think it's much more collaborative now, and I think COVID was a catalyst for that. And it gave birth to this great podcast, and really that was what it was about. It was third plug, was collaborating, and as a what I'm education leader at Passion Dental Group, and one of our biggest things is that leveraging technology amongst our clinics. So at my clinic, where we have a lot of the CBCT and implant workups, a lot of the dentists in our group will send the patients here for workups. If they don't do implants, then maybe that we're going to teach them, but maybe they don't want to, then they might send the patient here. So we're leveraging that technology so we don't have to have every clinic to have a CBCT, And I think what you're doing there is really good, because also some of this technology, like you mentioned about the SciCat function and the tracking system there, it was expensive, like $35,000 for that, and mine's in the cupboard, and so a lot of technologies, you buy them and all of a sudden something new comes out, and it's the upkeep really with technology, and one of those areas that I see ever changing is photogrammetry. And now you have situations where you even have, people doing it with their iPhones. So tell us about what you guys are doing on implant full arch scanning, and what technologies do you guys have there for scanning full arch?
Yeah, so the leading product that's been most successful for us has been our partnership with Keystone. So the Nexus product from Keystone has been incredible. So intraoral photogrammetry, again, it's scan gauges. There's a certain way you have to place them. It's implant agnostic, so whichever, if you're placing BioHorizons, if you're Straumann, Nobel, whatever it may be, you can place the scan gauges on top. You can use whatever scanner you want. All you need is the STL. Upload the STL into their software. It'll validate the passivity and the angulation of the implants almost immediately. And if not, it'll tell you, you got to adjust this one, or they're way out, they're splayed. There's no way you're getting passivity on that one. So you're not messing around with verification jigs anymore, wax verification jigs. So that has definitely been the leading one. That being said, we're the biggest laboratory in Canada, one of the largest in North America. We accept files from all the major systems. Absolutely. So if you've got PIC, the iPhone is coming without a doubt. You've got the iCam as well too. Absolutely. We can receive all of those files. It's an STL that we plan either in co-diagnostics or any of the surgical planning. So we can plan that from the get-go, no problem. We can even incorporate the iCam files into the Aurum Tech software and validate it that way also. So really depends on what your focus is. If at that time you're focused purely on the provisional, you can use the iCam, send the file to us, whatever. We can fabricate the provisional for you. I would hope you've planned enough in advance to say, okay, this is what the final is going to be like. Now let's do the provisional and work from the end goal and work backwards.
That is incredible how fast the acceptance of photogrammetry has occurred. And, the only concern that I have is, like, I know, Mike, in one of the drawers in the back, you have a lot of Duralay. And what do you plan on doing with that if it becomes obsolete? If there's no further try-ins and you don't have to utilize that for your complex implant cases? Is there a secondary market for it?
Yeah, I think, I could recreate like World War II fight scenes with the models, and then I could kind of link them all together with the Duralay, so I'm not having the guys fall over. Maybe that might be something.
Yeah, you should put that in your Tinder profile and see how effective it is. So, obviously lots of evolutions, especially in mandibular scanning. Photogrammetry has been a great evolution as well. Robert, what's next for the Face 4D program, and what other upcoming events do you have at Aurum?
Yeah, great question. We are really ramping up. We've got a tremendous partnership going with ORQ. So ORQ is a clinical risk assessment tool that kind of bolts into your practice management software, provides you with dials, a risk of, is the patient at risk for TMJ, perio, caries, all those kinds of things. From there, that allows us to get a full patient health score. And more importantly for you as clinicians, it allows you to better treat. You can't treat what you can't see. You can't diagnose what you haven't learned yet. This is a beautiful tool that helps you, and more specifically, it helps your team members. It gives you reminders that says, hey, we noticed that, let's say, Dr. Michelle, you're at high risk for TMJ. Have you talked to him about, a splint, surgery, whatever, Botox, whatever the treatment may be? So it's an incredible tool. So we've got a partnership with Dr. Kana and ORQ as well too. And so that's coming up. We've got a webinar next week, actually, as well too. And that's talking all about how to integrate that into your practice, and using that really to bring medical dental integration into your practice. That's one thing that I'm seeing everywhere, left, right, and center. I don't know if you guys are as well too, but why aren't we looking at, platelet reports, blood reports, things like that? Their overall health scores when it comes to treating orofacial. How many indicators of your oral health are there for the rest of your body, right? So ORQ is the gateway to all of that, to be quite honest. It looks at all of those health scores and says, boom, let's start talking about this and go down that path.
Right. I think you have a generation coming up who is much more savvy, and that's certainly one of their priorities, much more so than, my father staying with us right now. And, he's lived a long and healthy life, but all of the sophistication that his grandchildren have on their health vastly exceeds my father's, and even sort of the values they have. So I think that level of AI augmented or AI supported diagnosis is the era that we're currently living in. And I think that we have a customer base, a younger customer base who will grow into the main customer base, who that's going to be an intrinsic value for them for sure. You're going to flip the switch on us a little bit. You have some questions for OraQVest guy, surprisingly sitting to my right, and I. So let's go ahead with that, and we're on the other side of this now.
Okay.
I wasn't sure if I could shamelessly plug you and OraQ as well too, but
You did a good job. That's like we're almost at a full hand of plugs.
You were much more subtle, Robert, in your plugs. Mike needs a little more work on his. Yeah, not your PRP plugs though. Those worked really well today.
Nice.
next time I won't be. So, for both of you, I guess the question I had was, as the digital workflows keep evolving, do you see technology kind of bringing dentists and labs closer together, or is it going to create more of a silo?
No, I'll jump in on this one, Mike. I think this kind of circles back to the discussion we were having where I made the point that technology opens up the opportunity for dentists to treat more complex dentistry and to do it more predictably. So I think for simplistic procedures, you can probably utilize the manufacturing tools that are available within the office, but in a busy workflow, a busy day, unless, and we have friends who really they love that lab technician component. I was texting my friend from Winnipeg, Amy Rehal, and Amy is the exception to the rule. But for the vast majority of dentists, because they're now able to treat more complex cases, which better serves their patient base, you're going to have a digitally savvy lab that's there to support you. And I think that trend is sort of going in the opposite direction. When CEREC came out, you wondered sort of where that single crown would go. And that technology and market acceptance is sort of stagnated. But, these all-in-X treatments that we're talking about, or all these diagnostics that you set the predictability before anything starts, I think that's going to forge a better relationship between labs and clinicians moving forward.
Yeah, and I won't dive too heavily onto that because that was a great answer. But all I'll say is that I feel like collaboration is king now. And I think there's many other big picture things that are happening. Younger dentists that want better work-life balance. I know that's just a broad statement, but when I teach a younger dentist about what they could do with CEREC, some of them are like, oh my God, like really, I have to learn. You know what I mean? And I know the AI proposals are so good, it's so fast, and there's so many things, and patients love that same day visit, but there's still always going to be a usage amount. And then there's always going to be the people that just don't want to take on more. And so I think there's always going to be that collaboration. So I think as some of my age dentists really wanted to take on more, I think there's a lot of younger dentists coming out that want to take on less and less responsibility, but maybe, like you said, are able to take on more complex things than they maybe wouldn't have, because they're able to collaborate. So I feel that collaboration is key here.
Yeah, and I would say there's two things from our perspective that are really driving this change in the industry. One, patients are demanding the convenience, right? They're coming to you, they're coming to us to say, have you gotten this latest technology? Are you using AI to help assist with this? Like, that's becoming absolutely prevalent. And through AI, the access to information about materials of what's going in their mouth. I literally had a prosthodontist from a major university in Canada emailed me yesterday saying, hey, my patient came to me asking me about Duraflex and Valplast. I've been doing this for 10 years and I've never heard of that, a patient coming asking very specifically about those two products. Before AI, you'd have to do quite a bit of Googling to find those products, right? And then I think the other thing as well too is you talk about collaboration. And this is the most common question I get when I tour people through our labs is, tell me about 3D printers. I bring them back to CEREC. I say, do you have a CEREC? The decision tree is exactly the same. Yes. Well, why? Well, because I have people who can help in post-processing. I can design it. I can calibrate the machine, all that kind of stuff. No. Well, why not? Well, because I don't have that or I don't have the volume. So the decision tree is exactly the same. Now the barrier to entry for that equipment is getting drastically cheaper. I was at a full lab conference back in November. Literally all of my competitors, friends and enemies, my frenemies, with me in the room from North America, all over, but a lot from here in Calgary as well too. And one of the gentlemen from down in the United States said, "Hey, should we be concerned about all of these big companies like Sprint, right, whatever, going more and more chair side?" And a lot of them said, "Yeah, we got to be careful. We need to really ramp up the relationship." And I stood up. I represented the largest lab in the room, and I said, "Actually, you shouldn't be worried about it anymore because it's happening." The last IDS, there was over 400 intraoral scanners and 3D printers, many of which haven't even reached the North American market yet. So it's happening. But as we hosted a couple events for those printer launches recently, we said, there's still a limitation to what they can do, right? Absolutely. If you've got a great team who can help post-process it, finish it for the same day tooth, that's what the patient demands. That's what the patient should get. We support that. We're here to serve the patient too. But when you're doing the all-on-X, the full, beautiful veneers, they're not there yet. Also, the studies on the materials on the 3D printers, long-term studies aren't there yet either because they haven't been out that long.
Yeah,
right?
I agree with that.
Right. So the data isn't there. So those are a number of factors that we're seeing. But thanks for both of your input on that one as well too. Okay. Last one. So Dr. Sharma, for you as well too. You're shaping the curriculum at Spear, or at least that's what your LinkedIn profile said.
For better or for worse.
There is a plug.
There is a plug, Spear. How do you feel, the clinician lab dynamic is changing in terms of that education? Not necessarily in university, but when they come out and they start to learn real world applications, is it being taught more and more, or how has it changed at all?
Yeah, that's a great question. So actually in 15 minutes, I have a call with our chief dental officer, Mike, and I, our boss, Dan Butterman, and a famous prosthodontist from a university. I won't announce it just yet, but we're looking to launch a curriculum on lab training. He's a lab ceramist as well, certified lab technician. And we're going to be layering in dentists into this curriculum. So I think even from a dentist perspective, they're wanting to have a better understanding of materials and material manipulation. So it'll be a 2-day workshop on managing zirconia and EMAX from a lab perspective. So I think that we're starting to see, at least at Spear, we're seeing more collaboration with the lab. And as dentistry has become more complex, dentists can take on more complex things. They need their lab partners to be able to take on those complexities as well. So we're looking to actually build some educational resources to support the lab side of things. And, you guys are a perfect testament to this. Most of our customers are, of course, are US-based, as we're a US-based organization. But we have a lot of labs, many of your counterparts, that education is a big part of their business model. And so they're leveraging our expertise to support them where they can support their customers. So yeah, I think that, again, like I saw the trend being that lab utilization was going down until we saw very quickly predictable complex or complex dentistry, the predictability started to go up. And I'll circle back, Mike, to a point that you made earlier about younger dentists or earlier career dentists wanting work-life balance. Definitely. But even from a perspective of like the complexity of dentistry when you and I came out of school was much more rudimentary than it is right now. Where now you have to worry about guided implants, aesthetics. You're competing with every Instagram dentist now when you come out of school. So you have to be multimodal, much so than when we came out of school. So I also think that dentists, because they have to treat all this complexity over a wider array of disciplines, they can't also be exceptional digital lab technicians. You can't be great at aligner therapy and endo and all of these things now throw in digital lab components. So I think that there is certainly a place for it. And at Spear, we're developing some curriculum. So hopefully we'll have an exciting announcement within the next couple of weeks on that. Cool.
Yeah, I agree. That's great. Robert, anything else from you on?
I just have one last question.
Okay, let's go.
Maybe it's you because I just put him on the spot. Calgary as a market, do you think we are ahead or behind in terms of digital adoption?
Well, we're obviously one of the premier locations in globally, being that we host the Digital Workflow Dentistry podcast. So we know we're definitely way ahead of the curve in Calgary. That's 6, yeah. But historically, when the cosmetic boom happened in the early 2000s, they did a study on veneers, and Calgary had one of the highest in the early 2000s amount of veneer cases being done. Seattle was big, obviously Beverly Hills, but Calgary was in that demographic, and I'm not to belittle that concept, but we have clientele that have the disposable income, and as such, the Ferrari dealership in Calgary was one of the top sellers in North America. So, I think I think Calgary does drive a certain level of socioeconomic status. It does drive people to want to have more. And I do feel like our environment here is conducive to outdoor, is conducive to health and wellness. And there are so many medical clinics that are opening up that are about human optimization that I feel like I don't see that in a lot of other cities. So I do feel there is a real drive towards health and wellness, maybe brought on to by COVID, but I think Calgary is one of those hubs that I think maintains that. But we've seen it for a long time here, that we tend to be more ahead on what's happening in the digital workflows.
I think to elaborate on that as well is that, we all know that you become a product of your environment. And because there's been so many digital dentists in Calgary for many years, it turns into friendly competition, right? And it's not something that's negative. It's like, well, if Mike has a CBCT or if Mike is doing this, like, why am I not doing that?
Yeah.
And we were going through some cases today, and some of the socket shield techniques that Dr. Bolchi, one of our colleagues, has demonstrated, and you're going to be working on some really great cases that I'll be helping you with. Now I'm motivated. I'm like, okay, well, Mike's already taken the next step. Like, why am I not taking that step? So if you utilize observing your peers in a positive aspect, it can be incredible. And Calgary, I think, is an incredible place to practice for all the reasons you mentioned, but also because, your peers positively encourage you to strive to be better.
I'll ask one last one off script because I got to keep you on your toes. You have the whole dental world at your disposal for 30 seconds. What is the one thing you want to tell them? Start with you first.
Well, that's a good one. 30 seconds. I would say that we have a ever-increasing sophisticated clientele who's going to be demanding more from us in terms of health outcomes. And the only way to stay on top of that is through pathologic consumption of education, utilizing resources like Aurum. Mike's a great educator, utilizing those resources. A lot of them are in person, a lot of them are virtual. But in order to satisfy the demands of our future customers and current customers, we're going to have to really pivot the approach that we've taken to dental education.
Yep, and that's a good one. And from my perspective, I think looking at the patient in a holistic approach, and from an optimization approach is going to be ever much more huge and big. And I'll give you an example: periodontal disease linked to amyloid deposits, tau protein rises in the brain, leading to Alzheimer's. Right now, they've discovered GLP-1s. Tirzepatide that's now approved for treating obstructive sleep apnea because of the way it adjusts your flushing out of the CSF debris has reduced those proteins. So you sort of have this tangent where you're seeing GLP-1 drugs actually being able to prevent or cognitively protect you from Alzheimer's. So as dentists, periodontal disease is now somehow involved in cognitive health. We're, not from the Hangover movie where we're, they say we're just dentists, we're not real doctors. I really see that the evolution in dentistry is dentists are more and more in the trenches as real doctors. And, HPV being linked to so many cancers, all of these things, the mouth is the gateway to the human body. And we're becoming bigger and bigger proponents of health for patients. And with medical systems often being underfunded and underutilized and problematic, dentists are filling that gap with things like CBCT, sinus evaluations, and things like that. So that's my 30-second.
Well, that was over 30 seconds, first of all.
35.
But, that's fine. Robert, this has been a great conversation. If someone, one of our listeners wants to reach out to Aurum for some of these resources, what's the best way to get in touch with you?
Best way, head to our website, aurumgroup.com. Of course, we're on all the social platforms, usually at Aurum Group or at the Aurum Group. That's the best way to get a hold of us. You get a hold of me on LinkedIn if you need to as well, too, direct message. But yeah, website for whatever location is closest to you, and we can help you out.
Awesome. We appreciate that.
Great. Thanks, everybody, for listening and tuning in. Robert, thank you so much. Vishal, as always, great to have you representing Spears. And one more plug for you. And with that, we are face forwarding in time to the future of the digital patient. Thanks, everybody. Like and subscribe. Check us out on all the social platforms at Digital Workflow Dentistry, Digital Dentist Podcast. Take care, everybody.